Richard, it is so great to see you. I'm giving you a big hug right here through the TV. And I really want to hear, we all want to hear what you've been through and the warning that you have for us, because I know you were taking every precaution that you could possibly take against COVID-19.
I was. First, I have to say, Lawrence, that yes, the West Wing family made a difference in my recovery. They brought such love and such humor and such support, as did so many people around the world. And I'm so thankful and so grateful for that. Yeah, what was the question?
The question was, tell us about the scary part about this for all of us is, I know you were taking every precaution, and then yes. I know you got infected. I'm taking every precaution. I know it can happen to me. I just don't know how. I don't know when.
Well, it's scarier than you've read, and it's scarier than you've heard. There's something binary about this COVID-19 thing. It wants to beat you. It gets into your system, and it feels like wherever you think you can get a breath in, it's going to go there, and that's where the cough is going to go. That's where the it wants to stop you from breathing. That's what it felt like. It felt like that for 13 days until I finally went into the hospital. And all I can say is no one that I know was more vigilant. I kept my family from going out. We all learned how to cook for months and months and months. We did go back to work in Vancouver, and I was very much a part of of setting the protocols for production. Production's fine. I did not get this on set, and they're moving along nicely without people getting infected with this. But I can't stress enough that while some people are very lucky to get a light viral load and skip through this thing, especially younger people and athletes, those of us that are normal, this thing will debilitate you. And all of my energy is gone. My strength is gone. My muscles have atrophied. It's coming back ever so slowly. And even Sheila, who had a milder case, is still fighting to get some normal energy and so on. So Biden has it correct. You know, it's not a political thing. It's not a partisan thing. It's common sense. I can't stress enough to people that you do not want this. And the conversation that I had to have with Sheila, because it didn't look good there for a day or two, is a conversation you don't want to have with anyone ever. This is a tough one, and I just want to tell the American people and anyone listening around the world, it's so easy to take the steps to try to keep this from getting into your system or the system of the people you love. It's no guarantee. You know, we were very vigilant. My wife looks at it like you're trying to walk away from the sun. It seems to just be everywhere. But people who are taking the common sense steps are for the most part staying clear of this thing, and it behooves us as a nation and as human beings who want to just help each other to keep it to keep safe and to stay healthy.
Richard, what would you tell your friend Joe Biden about your experience in the Canadian healthcare system? And I know already how much you love and how grateful you are to all those heroes who took care of you at Vancouver General.
Yes, they're great. They're loving on top of being caring and very efficient. And they're a bit conservative. I got into some discussions with one of the doctors. I had to fight to get remdesivir. Still don't know if that made a difference or not. I expect that it did. And they're very much a part of believe in the studies and in what percentages are good. They do not want to harm ever their patients. but the efficiency of the hospital, the cleanliness, the food was good, was fantastic, and the fact is that I come out of there without a catastrophic bill, without a debilitating financial burden, and it's the first time I realized how wonderful that is to get sick, to go to the hospital for 5-6 days. It's a bill that in California would be hundreds of thousands of dollars, right? And I don't know what kind of copay I would be responsible for. I don't know how much my insurance would have covered or tried to wriggle out of. And here there is no worry about that. And everyone is treated the same. And they treat, I'm not a citizen of Canada. We have been working here for quite a few years on the Good Doctor, infusing a lot of money into their system, no doubt. But they do not discriminate against people that are not citizens if they have COVID.